Where are they? Oh, God. Here we go.
Okay. Good evening to you all. We'll just wait for a few more people to come in and then we'll make a start.
Okay.
Okay, so thank you for joining us this evening, and perhaps we can start by introducing ourselves and then we can begin this question and answer session. So I'm Nicole, I'm one of the trustees of the BDD Foundation.
Hi, I'm Rob Wilson. I'm also a trustee of the BDD Foundation and I'm a CBT therapist.
I'm David Veal. I'm also a trustee of the BDD Foundation, and I am a consultant psychiatrist in cognitive behavioural psychotherapies at the South London Maudsley Trust and at the Borough Hospital North London, and a visiting professor at the Institute of Psychiatry, Psychology and Neurosciences at King's College London.
Hi everybody, I'm Amita Jassi. I'm a consultant clinical psychologist in the Young Person Service with Body Dysmorphic Disorder and also a trustee of the BDD Foundation.
Wonderful. And this evening, we've had a few questions ahead of time, so we'll take a look at those. But if you have any questions during the session, if you could please pop them into the Q&A button, and that's where we'll be checking for questions. And then we'll use the chat in a more general way. But any questions you have, do pop them there in the Q&A function. So we're ready to make a start.
Sounds good.
Yeah.
Lovely. Okay, so we've had a whole range of questions, and thank you again for sending them in. And actually one that's really relevant to this, given that this is coming live via Zoom, is a question around the use of Zoom in the current context of COVID-19. So there was a question that came through about somebody getting a lot of pressure from their workplace to take part in Zoom meetings, and not only that, to have their video on during those Zoom meetings, and explaining that this is very stressful. So the question is, what would be your suggestions for coping with Zoom meetings? I'm currently participating with audio only, but there's always a comment about people not seeing me.
Well, I guess that there's a few options. One would be just think about whether you could use it as part of deliberately choosing to face it as part of an exposure for combating your BDD. I guess another would be to think more technically about whether it's the challenge is letting other people see your appearance, or more about just needing to not examine, not even shut it down so you don't see yourself. Or as I was suggesting in my webinar, which I think kicked off this series, which would be to not only use it as a sort of exposure, but to think of it as a form of attention training, and to practice maybe not paying close attention to your own appearance, not scrutinizing, examining flaws and so on. And again, using it as an opportunity to try and get a little bit of more control over the focus of your attention in such experiences.
I would and fully support all that. And I'm just wondering what the problem is. I'm just thinking, is it self-consciousness? Because obviously when we're looking at Zoom now, and I can see a sort of postage stamp of myself up there in the corner. But the most important thing is, if I'm talking, is not to obviously look at that postage stamp, but to really focus in on actually what I can see on the screen and the task of what I'm doing in terms of talking. And so I think the key thing is not to get distracted by your own appearance and on the Zoom. It's only a very small thing, which is very difficult to see.
Mm. And I guess just to add to that, and I totally agree with both David and Rob, sort of maybe think about how to build that up. So when Rob said about exposure, maybe trying it for shorter periods of time, maybe to kind of give it a go and build up your confidence, and then sort of trialing, as Rob and David said, sort of disengaging attention from the kind of the smaller image could be part of that. But just kind of taking it at your pace and to go, you know, it's quite a big leap maybe to go from sort of audio to being on the camera for the full meeting, and maybe just building that up step by step.
Thank you very much. And actually, as I'm listening to that, I'm thinking that in order to see some of the questions that people have previously kindly sent in, my screen is partially minimised, so I'm even smaller than I normally would be. So I wonder if that could be a way to have that graded exposure, that perhaps it's minimised and you're slightly smaller, and then over time you might feel confident enough to open out the whole screen. And
even things like modulating lighting. So if you have the lighting from behind you, it's a lot easier, a lot harder for people to see details of your face than it is if the light is coming to the front. So I agree, thinking creatively about grading things.
Lovely, thank you. And then quite a different question here. So thinking about some of the factors that might precipitate, if you like, BDD, and this question is particularly about young people, what sort of approaches parents, families can take in terms of messaging around appearance to prevent perhaps something like BDD becoming part and parcel of a person's experience?
I'm happy to start this off, and I'm sure other people will add things. I guess the first thing to acknowledge with this is sort of comments about appearance or things that parents do and don't do in itself is not known to cause BDD. So it's really important to share that, that actually we don't really know the cause of body dysmorphic disorder. And what we do know, it's a combination of factors, sort of biological, genetic, environmental, kind of early experiences, bullying. So comments in themselves or things that parents are and aren't doing in itself won't cause BDD. Having said that, I think, you know, there's always positives to thinking about it, and it's really great, you know, this parent is kind of thinking about the best way to kind of be approaching things. And I think generally sort of building body, sort of positive body self-image is really important, but also sort of not shying away from mentioning appearance, because that would feel really unnatural, because we all talk about appearance, it's kind of part and parcel of, you know, life, but maybe sort of focusing not just on appearance in their child, but kind of other aspects, and building that kind of positive self-esteem that, you know, appearance is not everything, and that's one part of many facets, and commenting on other things, so kind of things they're good at, you know, the hobbies that they enjoy, and kind of building that broader sort of perspective that they are more than their appearance, I think would be really important. But just to kind of emphasize, as I said at the beginning, you know, it isn't necessarily parenting or things that parents do and don't do that causes BDD. So just to kind of reiterate that.
Yeah, absolutely. You know, we're always looking to blame the poor parents. And it's, you know, it's a lot of responsibility the parents feel already. But I think it's about trying to, in many ways, trying to imagine that your loved one doesn't have BDD and really acting consistently with that, neither over-focusing upon appearance or avoiding it, or trying to constantly bolster their self-image by lots of positive reinforcement, because that can increase self-focus, attention and preoccupation. But really just trying to keep things in as much of a healthy balance as possible.
Thank you. We have a live question that's just come in from somebody present here as a participant. How can you cope when you have suffered with BDD for many years, but then have developed?
I'm going to spend a little bit of time in a future webinar focusing upon the dilemma of observable flaws in appearance. And when David and I wrote our book on overcoming body image problems, we were very fortunate to have a colleague called Alex Clark work with us, who is a clinical psychologist who specialises in helping people with observable physical flaws. So we really recognise that it is different sometimes in terms of having to be a bit more prepared to deal with people asking questions or making comments. And you know, we obviously understand that it does, for some people, make overcoming BDD more difficult. But still, even when people do have, recognized observable flaws that come from congenital problems or accidents and skin conditions and things, we obviously want to encourage people to not feel ashamed and too self-conscious, and to still focus on reclaiming as much of their life as they possibly can. And in a way, you could argue that you need a preoccupation with your appearance even less if you do have a real physical problem. And it's great to value other aspects of yourself and really real engagement in other aspects of life, so that you can try and reduce and power through the impact of that problem as best as you possibly can.
Yeah, just to follow up on that, just to refocus in on that idea that you are not your skin and it doesn't define who you are in yourself. And as Rob said, there are maybe additional modules that you may need help on in terms of trying to be ready or prepared for comments from people, because there are an awful lot of arseholes out there who seem to own what you want to be able to ask you all sorts of stupid questions about, well, how did you get your leg broken off, or this, that, and the other. Complete strangers who might come up to you in the street. And you may need to do role plays or something with your therapist to prepare yourself for idiots, really.
So be sympathetic that it's a little harder maybe, but but also don't let that stop you from getting as much out of life as you possibly can.
And a recommendation there as well to perhaps come along to the full webinar that's really going to focus on that aspect in particular. That's on the 17th of June at 7 p.m. UK time.
Thanks, Nicole.
Thank you. And I guess this is in some way related. It's a question about, are there any explanations about why visually, in my eyes, my appearance seems to change? How can we explain seeing ourselves in one way in one moment and in another way in another moment?
I think someone would get a Nobel Prize if we could do that. Well, we don't really fully understand that, but what we think is that the more self-focused you are, and the more that you get all your information from your inner world, and the more that you are infused with all that emotion and past memories and stuff like that, the more it depends upon the way you feel rather than what actually is happening in the real world, the more it's going to feel as if it's changing. Because, many people experience that sort of felt impression of how they look in their inner world. And if you pay attention to that and treat that as somehow it's real, as if that's how people see you, then of course, that's when you're going to get more doubts and more confused. And the more you keep checking that and monitoring that, the more confusion it's going to cause you. So the main message, of course, is to get out of your head. It's dangerous living in your head.
And I think there's something there as well about understanding or appreciating the different ways in which our brain interprets and processes information. So this idea that people diagnosed with BDD might have a greater propensity for local processing, so processing small detail visual information as opposed to processing information globally as like a whole gestalt or image, if you like. And then also the differences between the left and the right brain, that sort of more local processing style also pays attention in a very particular way, that means that there's it's set up in such a way that we almost see what we expect to see and ignore any difference to that, whereas the right brain is able to take a sort of more broad brush stroke view and able to see what's in the moment rather than an image or a reflection of the past. So even understanding some of that and recognizing the way our eyes interpret information is dependent on the brain and dependent on experiences.
And just to follow up on that, there is some evidence that people without BDD tend to have a rather rosy tinted view of themselves and see themselves as more attractive than they actually are, and that people with BDD may have lost those rose tinted glasses. And so again, it may depend upon whether you've got your rose tinted glasses on or not.
We know that, following up on that, that even in depression, for example, which is good at making your rose tinted spectacles fall off, one of the symptoms of depression can be that you feel very ugly. And people don't strictly have BDD, but it's a recognised part of depression, and that feeling down in mood will make all of your perceptions more negative. So not just being more negative about the future and being more self-critical in terms of being worthless, but also your perceptions of your appearance.
I think of myself as rather attractive, Rob. I don't know about you.
That's because your mood is always excellent, David. That's why.
Thank you for that. Thank you. And actually, connected to that, we have another live comment. So thinking about the ways in which what we see is interpreted. Somebody is talking here about struggling with memories of negative things people have said to them and about them in the past, and this translating into being hyper aware of how they look. Any thoughts about that?
Well, I think that really brings what we were saying before, because one of the things that happens when you look inwards is that it may activate those memories which have not been emotionally processed.
And when we've looked a little bit at this in some of our research in things like imagery rescripting,
Yeah.
for
But what I was thinking was that really good that you're making those links with some of those emotional links. And so in therapy, Rob has done some very nice case series of patients who had that sort of very clear links, and sometimes you can help reprocess those experiences.
You could try searching the App Store.
What is going on? Sorry, it is my Siri has come along. And so it is sometimes possible with imagery rescripting or possibly EMDR to sometimes help people to reprocess those experiences, to help them so they no longer have a sense of nowness about them and that they are just bad memories.
So it becomes a past that is in the past as opposed to a past that feels very present.
Exactly. I don't know if you want to say anything more about that, Rob.
Well, I think it's quite important to build those kinds of experiences into your understanding of how your body image is created. And it can help to strengthen a competing explanation for why you might feel ugly without necessarily actually being ugly or have negative views of your appearance. So I think you can build it in both as part of understanding, building a psychological profile of this problem, as well as sometimes thinking about ways to help to update those memories and to help, as we've said, to kind of put them more firmly in the rearview mirror.
Thank you. A little bit of a shift now to thinking about CBT. So somebody who's saying that they're wondering if there are any tips for people who have completed a round of CBT and are now trying to adapt behaviour and use the techniques learned. They're finding the whole process quite overwhelming and energy consuming and could do with some pointers. Thank you. So tips after CBT, how to keep it going.
There's quite a lot. Sorry, Amix, do you want to take that?
There you go, Rob.
Well, I was just I mean, it's quite important to think that sometimes that we can have problems that need a long time, some months to work at, to improve and recover from, maybe even a year or two. That doesn't necessarily mean that you need months or a year or two's worth of therapy input. But part of the idea is that you're on a path, you've learned the principles, you have some ideas and strategies to help combat BDD, and that might just take more repetition and practice. So I know it's not a very sophisticated answer, but sometimes it's just about repetition and practicing across a range of different contexts, different situations with different people, and not shying away from the more difficult stuff, because that can be one of the more difficult things to do when you're on your own and not working with a therapist, is finding the courage to take the plunge and maybe approach a more challenging social situation, or perhaps for some people it is indeed things like using Zoom. But I think the main thing is to persevere and try and be courageous.
Yes, I would definitely agree with that. And I think sort of when people finish treatment, it's really daunting for them, sort of thinking about that you know, moving forward. And sometimes what I might think about with the people I work with is what bits of CBT, as well as kind of working with therapists, are there kind of elements of that they think they could take forward. So for example, just sitting down and kind of reviewing how the week's been, what's gone well, what's not gone well, setting targets might just help that make them, you know, it feel a bit more manageable, because it does take time, as Rob said, and that consistency. But are there things that they can take forward and become sort of their own therapist, and things from the structure of the CBT or something? Is there somebody else, you know, who's not a therapist, but is there a supportive ear, somebody in their family or friends that they can just check in with and have those conversations that, you know, that they might have found helpful with the therapist to sort of keep them on track? Because yeah, it can feel really difficult going from treatment to kind of no treatment. So sometimes that's something people find helpful to think about.
And I would say really go for the long-term goals and value directions, you know, things which are really important to you. It may be relationships, it may be friendships, and really developing your career, all sorts of things that have been forgotten about and or never really developed. Now's the time to really focus on those. And that's what you still need, perhaps a supporter or a buddy that you can check in with.
It's important, that idea, to think about overcoming BDD as a process of reclaiming your life as much as it is about getting rid of BDD. That, and of course, then moving forward in life is a lifelong pursuit.
Thank you. And therefore rediscovering perhaps aspects and facets of personality, humour, passions that might have somehow got lost under the layers of struggle.
Absolutely.
And staying with this idea of treatment, we had a question come previously around SSRIs. So the question is, how do I deal with the triggers of taking SSRIs as part of my BDD treatment because of my fears around weight gain and changes to my body that taking this medication may cause?
Oh, I suppose I better answer that one. It would be, it's a uncommon side effect of SSRIs to gain weight. It's possible, but equally some people lose weight, and actually it tends to reduce appetite. So, but for most people, it doesn't seem to cause any particular change in weight. Other than taking a trial and monitoring and eating healthily, these are the most important things, I think. Always, if you are going to take an SSRI, and it's usually recommended when you've got more severe symptoms in combination with the CBT.
And that's, I think it's generally true that we tend to see people really balloon in weight when they're taking SSRIs. But I think it's important to take all of those appearance-related fears in the spirit of overcoming your BDD. Because really, of course, it's the very problem that's trying to, it's almost, I sometimes think of it as a kind of cunning enemy that's trying to maneuver you back into maintenance if it possibly can, and squirrel you out of anything that might actually help. And a fear of getting worse is a common concern in a lot of emotional problems that blocks people from really getting better. So I really encourage people to take that approach, that this is all part of my BDD trying to maneuver me back into just carry on chronically suffering, but I'm actually going to try and take those fears on and test them out rather than be pinned into a lifelong suffering from this problem.
Thank you. So we've somehow talked a bit about the two guideline treatments in terms of nice guidelines around CBT and SSRIs, but sort of backtracking a little bit, there were also some questions around access to treatment and how to even vocalise that you feel you require help when there's a huge amount of shame about the perceived physical defects, and a shame about voicing the concerns and how that might be taken up. And the question also goes on to ask, should they wait to speak to a BDD specialist? And how to have that courage to speak to a GP that may not have heard of BDD necessarily or know much about it.
Amit, do you want to say anything about the GP card that you've been?
Yeah, I was thinking that. I guess it's just that kind of that person sharing their experience. It's really common, you know, to take that plunge. I think what's positive is sort of that recognition that they think it might be BDD, which I think in and of itself is really positive, that somebody has kind of recognized that and is willing to take that forward. And I think we've developed lots of resources on the BDD Foundation with that in mind, because it's really, you know, it can feel really scary to take the plunge and kind of share concerns and try and seek help. So an example of that, which Rob just mentioned, is the GP card that we've developed, which I think is on the website, or shortly will be on our website, which
Kitty's just posted a link.
Oh, brilliant. So I think Kitty's just posted a link to it on the chat, and it's basically explaining what body dysmorphic disorder is and the symptoms, and kind of it's a shortcut so people don't feel they have to try and explain it. It's a kind of just almost like a pass to say, this is what I think I'm experiencing. And also I think it includes what next, because often, you know, GPs might not know then what to do. So kind of a referral onto a mental health service and the treatments that you should offer. So hopefully, and there's other resources on the BDD Foundation website that also might be helpful. But I think we recognise this is a common thing that people experience and worry about. So that was kind of the thinking behind that resource developing.
And perhaps go with somebody else,
yeah,
and waive the nice guidelines and things like that.
And emphasising both the distress that it's causing, but also the impact that it's having on your activities of daily living. The fact that this really is having a detrimental impact on the way that you're able to access and live your life. Yeah. And before we move on, there's just been a couple of things pop up. People asking, what is memory rescripting? Could you say a bit more about that?
Okay, so this is imagery rescripting is a technique that was originally developed for adult survivors of childhood sexual abuse, in which we wouldn't necessarily want to have people necessarily to relive those experiences as part of recovering from post-traumatic stress. But instead, the technique was developed to effectively do exactly what it says on the tin in a way, which is to rescript the memory, to go back into a painful, upsetting, aversive memory, and to change the ending so that you feel better. And this has then been tested in social phobia, depression, OCD, and we've done some work on BDD. And so a kind of very classic examples that we saw in our research were things like people imagining themselves as an older, wiser adult going back in time and intervening, dealing with a bully who was giving them a hard time about their appearance. And maybe I've got one memory of someone describing that they tipped a pot of paint over the bully just as they were taking the mickey out of their appearance. And what happens is that it helps to modify the memory. You never really forget that something else perhaps happened, but the images that are associated with that memory, and therefore the meanings that those images carry, oftentimes can be quite significantly improved. So you're really using your imagination to great advantage there to change the images stored up in your head that your mind might be drawing upon to construct your body image. And if we can update those for the better, you're likely to get a better body image.
Thank you. Thank you for that description there of imagery rescripting, Rob. Okay, so just some more general questions, really. There's a question, or there's a couple of questions, but this one in particular around coping with mirrors and a reference to the hairdressers, and perhaps particularly in the context of the current context where some of the hairdressers, well, all of them have been closed for a while, and now this fear of going back and having to face oneself in the hairdressers. Any tips for that?
Well, one thought would be to do a little bit of practice first, to make sure that it isn't the first time that you sit in front of a mirror for an extended period of time. And it is an interesting phenomenon that with the body image, most people will start to experience their appearance feeling a bit different. They spend an extended period of time staring at their appearance in the mirror. It's a very abnormal thing to do, and it quickly overloads your that part of your information processing system, and you will start to feel like you look a bit funny often. It's a good way of sometimes introducing people to what BDD is like in a very small degree, is to ask trainees to spend a good bit of time staring in the mirror and scrutinizing their appearance. So partly I'd suggest cushion the blow a bit, practice a little bit at home in a similar kind of, try and replicate the experience of sitting down in front of a mirror, and don't make it the first time that you've done it, because obviously it's harder to escape and you feel a bit trapped or more anxious and things.
And maybe you could do it with somebody doing a role play of cutting your hair and asking you stupid questions about where you're going, this, that, and the other. And really focus in, I guess, on what you can see in the mirror rather than how you feel. And looking at yourself as a whole.
That's the main thing, and it's that trying to go for global processing of one's appearance. But in an extended situation like that, go for global processing of the whole environment. The things you can hear, the things you can smell, the conversations. I'm always earwigging into other people's conversations because being a therapist, I'm clearly just nosy. So just really try and broaden out your attentional awareness as well.
And I think part of that is stepping away from the mirror. You know, it's very unusual for anyone to speak to anyone as close up as some of us may get to the mirror at times. And even practical things like setting a timer or having a clock in the bathroom and saying to oneself, okay, at 5 past, I'm finished in this mirror and off I go. And as difficult as that is, making an effort with some of those actions can be helpful, I think.
Sure. Absolutely.
I mean, I'll just go back to something Rob said. I did do this. I've never tried it again. I spent about half an hour, I couldn't bear any more, with a bit of Wagner in the background and really focused my attention in a bit, something to make me a bit more depressed and thinking about bad things, and really homing in on those bits of me that I don't like, and really compare myself, and really felt very self-focused. It was the most awful experience I've ever had in my life. And yet this is, you know, this is something I know what my patients with BDD are just doing all the time routinely. It is extraordinary.
So practice and try and see it as an opportunity to not scrutinize and not be too drawn into over-focusing on your appearance.
Yeah.
Thank you. Thank you. And something there as well about that global processing, so zooming out and practicing seeing the whole thing, including the background and not just that perceived flaw in the looking glass.
Absolutely.
And connected to this as well, suggestions for when BDD thoughts and images, which may be ignited by spending a long time in the mirror, become the subject of dreams and cause sleep interruptions. And this person says, this only seems to further verify my concerns, and the subsequent sleep deprivation then exacerbates my rumination and low mood, tipping me into a vicious cycle of poor sleep and excessive fixation.
We know that people tend to place greater significance to spontaneously occurring mental events. So if you've had a dream or an intrusive thought that's popped into your head, we're more likely to see it as being significant in some way, revealing a truth, which is partly thanks to all the nonsense that psychiatry and psychology has pumped into the world for many years. But it's important to really question that, whether the dream is in any way significant, because it's just your brain chewing the fat, processing and bimbling away in the background when you're asleep. And you only remember the dreams that you happen to wake up in. And the rest of them, you don't even know that you may have had other really amazing dreams you slept straight through, and therefore you didn't know that you had it. So it's important to be skeptical about whether there's real significance in those dreams, and perhaps understand that probably it's a product of overloading and overstimulating parts of your mind about your appearance during the day, and maybe just run an experiment to see if you can try and reduce preoccupation across a few weeks, and try and see whether that has an impact upon your dreaming. So almost consider them as an output, and almost as something you could use as a measure of progress.
I think it's a really tricky one, that, and because it's not in your control. And I think I would probably focus someone on trying to help improve their sleep and sleep hygiene, making sure you're still getting up routinely at the right time in the morning, and opening the curtains and keeping in sync with the sun, and making sure that you do all the right things for getting a good sleep in terms of exercise and not coffee too late in the day and not drinking at night, all these sorts of things in terms of trying to improve your sleep. But I acknowledge fully that this is, it's going to make you more depressed, and in terms when your sleep is more disturbed, and make your BDD worse as well. So I think it is it's a tricky problem.
It's really making me think actually of a sleep study, and there have been many where they were trying to induce particular kinds of dreams in the participants. So they got them to look at particular things for hours a day on the computer screen. I remember one of them was playing tennis, and a significant proportion of people then reported they had dreams about playing tennis. So the things that we focus on during the day, those can become images that replay themselves, understandably so, in our dreams at night. And I guess that's also worth thinking about in terms of if we are spending hours and hours a day scrutinising or engaged in safety behaviours, they may indeed spill over into our dream state. And part of that is the brain making sense of and processing those waking hours that we've experienced. We have a question here about ageing, and I guess connected to this is changes in the appearance over the lifespan. So how do I deal with ageing? This is one of my biggest triggers. Permanent changes to my appearance feel completely terrifying and extremely worrying.
Well, it's a common part of BDD, of course. And I would commit to treating it really very much. I mean, and this in many ways, this is the $6 billion point across so much of overcoming BDD, which is to really commit to treating it as if it is a psychological fear or worry kind of problem. I'm thinking of actually, I think our colleagues in the States maybe tend to use things like enhancing flaws a bit more than we might as part of exposure. Am I right, David? So maybe
possibly, yeah.
You could trying to use some makeup to exaggerate those aging wrinkles and things, and really go for some exposure to really confront those fears.
More grey hair.
I'm working on that.
Yep.
Oh, I think this is a really tough one. I don't know if it's also, but interesting. I think in BDD, of course, it's focused on aging, and I think in other people, it's more focused on dying or losing function as you get older and you're getting more illnesses. So it's, different types of problems, different people have got different fears and things they're trying to, because these, of course, are all normal. None of us wants necessarily to die or to become older and iller and so on, but they're all we all have to adapt. So it is just it's a sort of normal worry, isn't it? Which has become 100 times worse in BDD in terms of aging.
But I think it's important, a bit like with health anxiety, when people think about dying as being a uniquely different problem because it's inevitable, and therefore really surrender to, well, not exactly surrender to, but really become more hopeless about overcoming it. And I think it's important the same with BDD and aging. Just because aging is unavoidable, it doesn't mean that you should feel more hopeless about overcoming your fear of it. I think almost those kinds of problems need almost a little bit more counter-attack, and saying, okay, this is a more understandable kind of concern. Therefore, I'm going to push even harder to reduce my preoccupation, to overcome any fears, to drop safety behaviors, to not be overly cautious about sunshine and potions and lotions, but to really redirect one's attention and absorb your mind into other aspects of living and preparing for aging gracefully and living a life that you're going to look back in your deathbed and think you were relatively pleased that you led.
Rob, I've just thought of a nice party. You remember I had on my birthday party an anti-necrophobia and death party where we embrace death in all its different guises and superstitions and things.
It was great.
You can read about in our Overcoming Health Anxiety book. But I'm just wondering whether we could actually encourage aging parties.
I'll be 50 soon, so I'll think about it.
Everybody comes dressed in terms of and various party games to do with aging in your appearance. We have to embrace these things. One year I was a medical student, I remember we were allowed to take over a old people's home to live in to prevent the occupiers and things. And certainly one of the parties we had then was an old person's party where everyone was encouraged to come dressed as an old person and aging and everything else. And we had lots of enormous fun around that. It can be quite a way of embracing these things.
And I guess part of that is acknowledging that our appearance does change across the lifespan. And I think that does connect with some other aspects of BDD in terms of the sense of instability and unpredictability of, say, for example, the skin or the shape of the face or the hair or whatever it is. And this idea of it would just stay the same, then I could come to terms with it. But the fact that it's changing all the time means that I'm constantly having to change my relationship to it. And part of the invitation, it sounds, is to be open to that constant changing of that relationship with one's body and one's appearance, that it isn't static and it isn't going to be, and that is indeed part of the human experience somehow, as difficult as that may be at times.
Completely agree. But understand that preoccupation is an amplifier of those experiences. So that whatever you're going through, and this is true of pain, physical pain as well, that it's excessive, if you become very afraid of being in pain and very preoccupied and are very focused upon it, your experience of the pain will be significantly worse. So these things can run side by side. It's important to be kind of philosophical and get a perspective on things like aging, but also whatever the concern is, really focus on driving that preoccupation down, reducing the amount of time you spend thinking and worrying about appearance, the amount of time that's spent engaging in activities around appearance, so that it doesn't amplify those emotional reactions.
Thank you. Thank you. A slightly different question here that's come through on the live chat to the one we've just been discussing is trichotillomania, so the compulsive pulling out of one's hair, linked to BDD. I have both, and having no eyelashes drives the shame and embarrassment of how I look. How can both be tackled most effectively?
Well, if no one else is going to say, trichotillomania, skin picking, and other habit disorders are best treated by habit reversal, learning how to become more aware of when you are doing that particular behavior and trying to do something that's learning to do something that's incompatible with that behavior. It's tricky and it is difficult, and takes a lot of practice to try to become really aware of your behavior and choosing to do something that's incompatible. Very difficult.
Completely agree that habit reversal is a really important part of the treatment. But the other two, just spotting something I've learned over working with people, is that it's for some people they accidentally put the cart before the horse, so that they decide they need to stop their skin picking or hair pulling before they overcome their body shame, which makes sense in the sense that if I could have less to be ashamed of, like I don't have any marks from skin picking, or my eyebrows, eyelashes and so on are okay because I haven't plucked them, then I'd have less to deal with in terms of things I feel uncomfortable about. But it can mean that you're in the vacuum of experience and you're kind of in a sort of your own BDD lockdown because of the way that BDD will interfere with the quality of life and limit your activities and so on. And of course, if you're in lockdown and you've got more space and the devil makes work for idle hands, and you're more likely to end up picking and pulling if you live in a vacuum. So one thing to think about, and I realize this is way easier for me to say than it is for people to do, but it does seem to be helpful sometimes, it is to focus as a priority on the body shame, and really try as much as you can to break free from that and reclaim life and function activity, because that will naturally make you feel more rewarded. It's likely to improve your mood. It's likely to keep you busier and more distracted. And that would hopefully make the job of reducing picking or pulling and things a little bit easier, and not get caught in that vicious cycle of work, hoping one problem will improve, but therefore being locked into the other.
And for me, I guess part of it is also around the sensory elements and the nervous system regulation elements. So, you know, if high states of anxiety, that hyperarousal, or even states of numbness and low mood, that hyperarousal are part of the experience, as they often are of BDD, then part of the experience of picking the skin or pulling out the hair might be soothing in some way. It might feel that it brings you down or brings you up to a place that feels more, you know, that window of tolerance where you feel more able to cope and have a sense of your own resilience. And I suppose, therefore, it's acknowledging that part as well. And perhaps creative about ways of perhaps providing that visceral feedback or using the hands in another way that support that nervous system calming but aren't necessarily detrimental to your physical health or perpetuate that cycle even further, perhaps.
And that's where I think sort of formulating and understanding it a bit further is so important, to see kind of what triggers and drives that behaviour, to then think about how to intervene with habit reversal. And as you're saying, Nicole, and also we know sometimes hair pulling and skin picking can be part of BDD, so it could be driven by trying to sort of, I know this person hasn't asked that, you know, thinks it's trichotillomania, but sometimes people do those things to improve appearance. So really understanding what's driving the behaviour and thinking about sort of what tool would fit kind of to help them overcome that.
Thank you. So perhaps a drive to clear the skin or smooth the skin or even out the hair or something like that could be a driving force. And I know that Simon Darnley is coming to do a webinar on the last Wednesday of the month. I think that's the 24th of June at 7 p.m, particularly around body focused repetitive behaviour. So that might be of interest to you. There's a really lovely question here around self-acceptance and any tips or practices, techniques for coming to a place of greater self-acceptance.
Well, part of me thinks that it's important to come back to Amita's point about building formulation, and that to first make sure you understand about what's disrupting that self-acceptance or keeping self-acceptance low, because there's a tendency to try and build concepts like improved self-esteem, self-acceptance and so on top of things. But if you don't understand the problem that's underneath, the maintenance in terms of avoidance and self-focused attention and compulsions and things, then you're going to have a hard time building good self-acceptance if you've got something that's constantly eroding it. So I still think in a way it still comes back to those kind of basic principles.
And I suppose really having a good understanding of what self-acceptance means, because as Rob knows also that some people think of it as self-resignation, resigning myself to being ugly, which of course it's not. And the key thing is not judging, and that's the most important thing in self-acceptance, and not evaluating, rating, comparing.
And it's always important to remember the fake it till you make it kind of principle, the acting as if, that to really make sure your behavior in a way, first you act as if you accept yourself, and I'm saying that will kind of help to drag the rest of your thinking emotional system into the right sort of position. And one of the things I really like from some of Paul Gilbert's work on compassionate mind training is this idea of really formulating a clear image of a more compassionate self, or we could think of an image of a more self-accepting self, and really think through how that person lives, what they do, even how they walk down the street, the way they might hold themselves, and really try and get into almost thinking of it as like a method acting kind of process. So you really build that sense of, just I think just building upon David's idea, really first understanding what it means, really trying to build that sense of it, and then trying to act consistently with it.
And go back to the idea of acceptance of self, because, you know, I can accept I might have said some stupid things tonight, but even if I said some stupid things tonight, it doesn't make me stupid through and through as myself. Yeah. So keep separating out bits of you to somehow the whole of you.
Yeah, it is. Who is that self that I am accepting? Is that self the physical entity that I see in the mirror and that others see? Is it the personality, the likes and the dislikes? Is it my life experiences? And is it that whole package? And also something a bit intangible, that felt sense of self, that felt sense of I, that's sometimes quite difficult even to describe. Considering what is it that we're accepting, and how is it possible to show compassion to each of those aspects of the self? Thank you for that question. Paul Gilbert's work is really helpful there, I think, isn't it? And Christian Neff and others with the compassion focused.
We're hoping maybe to persuade someone to come and do a CFT based webinar as well. So watch this space for a bit like that if we can get it.
Okay, so we probably have time for just one or two more. And there's actually two questions here that are very similar around cosmetic surgery. Is it always advised is it always not advised in people struggling with BDD? Does it ever help BDD? That sort of a theme coming out in some of the questions I'm seeing. Well, I guess that goes for dentistry and dermatology and all other physical.
Yeah. Well, I think that, look, we know that for some people, they may have some satisfaction from having a piece of cosmetic procedure done, and they may feel a bit better about it, but it doesn't usually improve the symptoms of BDD, and they remain preoccupied. And especially when there's multiple preoccupations, it usually just sort of moves from one other area to another. Sometimes it makes the preoccupation worse. And I think part of the problem is that people up here see all the people who have, by definition, failed in cosmetic surgery and practitioners in various ways, and are very unhappy about what they've been through. Sometimes there have been some positive experiences, but in general, I suppose we don't necessarily see in cosmetic procedure practices those people with very mild problems who may be satisfied. So there's no easy answer to this, but in general, I think if you're watching this and you clearly suffer from BDD, it's very unlikely to help improve your BDD symptoms. You may get some satisfaction from the procedure, or it may get worse. You know, it's complicated. And there are some procedures that seem to be more risky, particularly rhinoplasty and some dermatological procedures. And there are other procedures like breast augmentation or perhaps pinoplasty that seem to maybe a bit safer.
It is very interesting. David and I both have been part of a special interest group for psychologists working with cosmetic surgeons. And it is very interesting to talk to cosmetic surgeons who are very clear that even in individuals without BDD, there are plenty of people who aren't very happy with the outcome of their cosmetic procedures. As David highlighted, particularly things like rhinoplasties. And we think we oftentimes get better results with our psychological treatments for people who are concerned about their noses than they get sometimes with their rhinoplasties.
And the cosmetic surgeons have to pay about 20% of their income to medical defense insurance because there's so many complaints and problems. And
yeah, and I think occasionally we do see people who I've known people who've got somewhat better with their BDD. They've made some progress with it, that have gone on to have cosmetic procedures. That seems to be a little bit safer. Seen one or two people that have done a bit better with it, but it's very, very important not to pin your hopes that if you remove the flaw, it'll go away. Because oftentimes what happens is even if you have removed the flaw and you're happy with it, then your brain assumes, well, that's the route to go. And then every time you have an aspect of your appearance you dislike, you assume you must be able to improve it. And there are some areas of the body that's very difficult to do that. So you run into a wall where the solution might have worked on one area, but it won't work in other areas as the problem shifts around. So then you have to go back into working on the psychological processes.
Thank you. And I think that connects to the Theory A, Theory B model that I think Anita and also Rob, you spoke about in both of your webinars around treating it, even if the person feels like it's an issue that is physical in nature, treating it as if it is BDD, as if it's emotional in nature, and then seeing how that might shift some of the desires for cosmetic surgery, dentistry and dermatology. Yeah. Okay, so perhaps we'll finish on this one, unless anything else pops in last minute that we feel would be important to cover. And if one of your questions has come up this evening or was sent in advance and hasn't been covered, our sincere apologies. It simply wasn't time with the vast amount that we received to cover them all within this hour. However, please be assured we'll be taking them away and looking very carefully at them and considering them in light of future webinars as well. So I think this is such an interesting question. What about when mindfulness or attention refocusing just seems to exacerbate things, e.g. appreciating the beauty of nature and things around us that seem to heighten the blight that you feel that you make with your appearance in comparison?
Well, the problem there, of course, is that the power of a kind of BDD perseverative maintaining process like comparing is overwhelming the mindfulness training. Mm. So we'd really want to focus on really targeting comparing as a unhelpful strategy, almost think of it as kind of a bit like a kind of habit to try and break. And really looking at the motivations you have for that comparing, and really going over the costs and benefits of it, and really working on trying to break free from that strategy as I say, I was thinking it was a bad habit, really working to try and compete and conflict with comparing, seeing opportunities to practice not comparing as best as you can. So that then doesn't flatten the benefit of things like mindfulness.
But I think, Rob, you'll agree that mindfulness, as you know, is everyone knows, is not a treatment for BDD. It may be something when you recovered from BDD, may help you to reduce the risk of relapse and so on. But I think what we do want to emphasize is it's more what we teach more is situational refocusing, trying to focus more, as the person said, on what's going on around them and the beauties and so on. But as Rob said, not going back into their head and then comparing and activating their own perseverative thinking. And it's a really, look, we all recognize, we understand, it's really tricky, it's really difficult. And as Rob said, it is that perseverative, repeated, ruminative problem that trying to get out of.
It's a good idea, actually, though, to think about whether it's going to be useful to switch into
I think Rob was frozen there just briefly. We'll just wait to see if he comes back. So I'm sure he had something very important.
Very important.
That way, it was just,
because,
yeah.
Go for it, Amita.
Oh, we've got Rob back now.
Sorry, Rob, you froze there just before you were going to make your point.
Stuff I've ever said. That's the best stuff I've ever said about BDD. I don't think we'll ever get it back. I was just saying that probably it's another thought would be picking up and building on David's point, is that maybe tuning into things that are aspects of the environment are less likely to activate that problem. So ground underneath your feet, things you can hear, that kind of stuff, so that you still work on situational refocusing, but maybe in the short term try and navigate around aspects of the environment which are going to be more likely to activate those comparisons.
Thank you. Someone said here, would it be useful to just focus on colours rather than beauty as a suggestion there? Okay, it's making me think actually of Van Gogh's, making me think of Van Gogh's painting of the old boots and how long he must have stared at those boots and how mindfully to have painted them in so much detail. And I guess there's all sorts of things that we might choose to focus our attention on, but also choose to see in many different ways. And I guess that's part of the practice of mindfulness, is that non-judgmental observation, not only of what's external, but also perhaps of what's happening internally in response to that external stimuli.
You mean not judging beauty? It's just stuff.
Stuff. It's boots, it's apples, it's human beings, it's the sunrise. Yeah. Okay, well, thank you so much. I found that incredibly interesting and learned a great deal. I hope it was useful to everyone here present. Were there any final comments, Amita, Rob, or David, you'd like to make before we close?
I think I think that there's a rider with everything we're saying, which is that if we were to explain, if we take the time to explain how difficult we get that BDD is and how hard it is to overcome and how much more complicated it is than we're able to describe it, we could take up the whole hour. So we'll but by trying to offer snippets of advice and thoughts, we don't mean to imply that it's so simple. We're just trying to add a little bit of some ideas and suggestions to try out. But with those suggestions and ideas and practice and perseverance, we do see people get better.
Yeah.
Thank you for that. I think that's a lovely note to end on. So a very good evening to you all. And we hope
thank you everyone for the questions.
Thank you.
Thanks for the panel too.
Thank you. Goodbye.
Bye.